Are you feeling dizzy, lightheaded, or like your chest is just too heavy? That may not be old age, it could be dangerously high blood pressure. And if you're over 60, ignoring this warning could be the biggest mistake of your life. Right now, 1 in every 2 adults over 60 in the US has elevated blood pressure. And here's the frightening part, many don't even know it until it's too late. Let's not sugarcoat this. High blood pressure is called the silent killer for a reason. According to the CDC and the Mayo Clinic, uncontrolled hypertension is the #1 cause of strokes in seniors. It's also behind most heart attacks, kidney failures, and even vision loss. You might look fine on the outside. But inside, your arteries could already be stiffening, your heart overworking, and your brain slowly starving of oxygen. One wrong step, one moment of stress, and everything can change. A wheelchair. A hospital bed. Total dependence. That's what's waiting, unless you act now. But what if I told you you could start reversing this damage in just 5 minutes, using nothing but your breath? That's right. According to the knee and research published in Hypertension, slow, deep breathing for just 5 minutes can lower your systolic blood pressure by up to 20 points, no pills, no equipment. Here's how to do it right. Sit upright. Close your eyes. Inhale slowly through your nose for 4 seconds. Let your belly rise, not just your chest. Then exhale slowly through your mouth for 6 seconds. Do this 6 times per minute for just 5 minutes. That's it. That alone can signal your parasympathetic nervous system, the body's natural blood pressure regulator, to calm everything down. The results? Noticeable, immediate, and proven in clinical trials. Now, while breathing is powerful, there's another method that seems almost too simple to work, but it does. All you have to do is squeeze something. According to the American Heart Association, isometric hand grip exercises, like squeezing a tennis ball, a towel, or even your own hand, can reduce blood pressure by up to 10%. Here's how: grip the object in one hand. Squeeze it at about 30% of your maximum strength, firm but not painful. Hold for 2 minutes. Then switch hands. Do 4 sets total. And why does this work? Because squeezing boosts nitric oxide levels, strengthens your blood vessels, and improves arterial flexibility. It's almost like giving your heart a tune-up without breaking a sweat. Still don't believe it? One study from the Journal of Hypertension followed seniors doing this 5 days a week. After 8 weeks, their systolic pressure dropped by an average of 14 points. That's equivalent to some prescription drugs, without the side effects. So, we've covered breathing and squeezing. But there's one more trick you can do, at your kitchen table. You've seen it in salads. It stains your fingers red. And if you drink its juice, you might just drop your blood pressure by 10 to 15 points within 3 hours. We're talking about beets. That's right, beetroot juice, rich in nitrates, helps your body produce nitric oxide, which relaxes and dilates your blood vessels. A study published in the journal Nutrition found that seniors who drank 1 glass of beet juice daily saw their systolic blood pressure fall by an average of 11.2 millimeters of mercury, almost instantly. Boil them, blend them, or juice them. But don't ignore them. They're one of nature's most powerful pressure reducers. Now, here's what most doctors won't tell you. Most of them were trained to treat high blood pressure with medications as a first line of defense, not as a last resort. But did you know that Harvard Health and Mayo Clinic both confirm lifestyle interventions, like the ones you're hearing now, can be as effective as pills for early-stage hypertension? And the reason deep breathing, hand grip squeezing, and beets work so well is simple: they all target the same hidden system inside your body, the autonomic nervous system. More specifically, the parasympathetic branch. This branch is your body's calm down button. And the older you get, the less active it becomes unless you reactivate it. Pills bypass this system. But these 3 techniques restore it. And here's the kicker: most doctors don't push these methods, not because they don't work, but because they know most patients won't stick to them. Prove them wrong. Do what others won't. Now, let's talk about one of the most common daily mistakes that spikes blood pressure, especially at night, and could be silently hurting you. Are you taking your blood pressure meds or supplements first thing in the morning? If so, you might be risking nighttime hypertension, the most dangerous kind. The Mayo Clinic now recommends a simple timing fix: take your blood pressure medication at bedtime instead of in the morning. This alone can reduce heart attack and stroke risk by over 40%, according to a landmark Spanish study published in Hypertension. And even if you're not on meds, avoid salty dinners. Sodium retention is highest at night. Eating salty foods for dinner raises overnight blood pressure, increases fluid retention, and causes morning dizziness. So, switch your high-salt foods, like soup, canned veggies, cured meats, to lunch. And keep dinner light, warm, and potassium-rich. Think sweet potatoes, spinach, or lentils. These foods calm your nervous system and protect your arteries while you sleep. Before we wrap up, here's one mistake most seniors make daily, and it leads to panic and over-medication. They measure their blood pressure wrong. The NIH says up to 20% of home readings are inaccurate, and the consequences can be devastating. Here's what you must do. Sit still for 5 full minutes before measuring. Keep your back supported, feet flat on the ground. Rest your arm on a table at heart level. Don't talk or move during the reading. And take 2 or 3 readings, 1 minute apart, then average them. Also, never take a reading right after a meal, a walk, or emotional stress. Your pressure fluctuates. The key is consistency. Let's briefly break down why these 3 methods work so well together. Deep breathing triggers baroreceptors in your arteries. These tiny sensors detect pressure changes and signal your brain to slow your heart. Isometric squeezing tones vascular smooth muscle and increases arterial compliance, making blood flow easier. Beats boost nitric oxide, which dilates arteries, reduces inflammation, and improves kidney filtration. Together, they form a trifecta that tackles the root causes of hypertension, nervous system imbalance, vascular stiffness, and endothelial dysfunction. Compare this to a pill, which only masks symptoms. These habits fix the root problem. If you're over 60, the time to act is not tomorrow. It's today. Hypertension doesn't wait. Every moment you delay, your arteries may harden more. Your kidneys may weaken. Your brain may suffer micro-strokes you won't notice until you forget where you parked, or worse, forget your family. But the great news? Your body is more powerful than you think. In just 5 minutes a day, you can begin reversing years of damage. 5 minutes of breathing. 2 minutes of squeezing. 1 glass of beet juice. Simple. Powerful. Proven. You're not too old. You're not too late. You're just one decision away from better blood pressure and a safer future.